So with us we have Dr. H S Rathod, and he's practicing in Udaipur. Yeah. We'll be keeping the topic as kidney stone management, and we'll be having the insights by the doctor we have here. Well, sir, why do you think the number of cases of kidney stones are on high rise these days?
Basically, it's a lifestyle mostly because most of the youngsters they are consuming the junk foods, more salt, less liquids. The lifestyle is progressing towards the obesity. Obesity is biggest risk factor for stone diseases. So this is the most common reason because people are not following the dietary consideration that can causes more stones and more problems regarding the stone diseases.
Right, very true. What has been the most challenging case you have ever dealt with, and how did you remove the patient's stone? Were there any cases?
Yeah. I have remembered a case I have dealt with in last only 15 days back. And that was a huge kidney stone, and that was extending into the ureter around 4 centimeter, and there was almost 6 centimeter stone in the bladder also. So that was a complete stone scenario where you have a stone in a kidney, large stone in a kidney, large stone in a ureter, and a large huge stone on the in the bladder also. So I completely removed that stone in endoscopic way by the PCNL, laser URSL, and laser lithotripsy, and patient is doing well, and total is complete stone was removed. So in recent after recent advances in the medical sciences and technology, we can do it without harming much to the patient, and patient recovered so fast.
Wonderful. Well, in your experience, what precaution a patient can effectively take in order to avoid the occurrence of stones? And if, for example, I have had one already, I would like to avoid the recurrent stones. What would be your suggestions?
That is the most important thing, how you prevent the stone and how you prevent the recurrence.
Yeah.
So first of all, that we have to maintain a good hydration. You have to produce at least 2 liters of the urine, so that there is no concentration of the urine, no crystallization, and you can prevent the stone formation. So in any season at least you have to produce the 2 liters of urine. So accordingly you have to consume the fluid. In winters you may consume around 2.5 to 3 liters, and in summers you may require around the 5 liters of the fluid intake. Second, you have to restrict the salt intake. So you can prevent by restricting the salt, avoid the junk foods, avoid the cold drinks like carbonated drinks, and also you can prevent the stone formation by the taking less consumption of the red meat and all these animal products. So by that way you can prevent the stone formation.
Well, are there any misconception that a patient have and they comes to you? Would you like to break any myths when it comes to kidney stones?
There are many myths. One thing is like that if you consume the carbonated drinks like beer and all these, stone formation is less in these people. No, it's not like that.
Stone will pass away.
No, it will not pass. It will not pass, as well as the stone formation is more with carbonated drink, including the beer also. Second thing, there are lot of quack practices in the rural areas. What they do, they have given analgesic to painkillers to you, and you are continuously consuming that painkillers, and ultimately once you reach to us, the kidney is damaged. So it's better to go a perfect person who can deal in a good
specialist,
way.
actually.
Deal in a good way. It may be urologist or surgeon.
Yeah.
So consult with them and take a treatment accordingly.
Well, for example, if a patient might be having a stone, what are the symptoms wherein he can have an idea that I might be having a stone?
Yeah, most common symptom is a pain, definitely. Stone mostly causes pain. If stone is a kidney and a ureter, the patient will get a pain on this side, that is a flank pain. And if stone is in a lower down, like a lower part of the ureter or in a bladder, then mostly they have a urinary symptoms, painful urination, burning micturition, and sometimes blood in urine also. So all these symptoms are factors. In advanced stage, patient may present with infections, may present with decreased renal function, kidney functions also. So all are these symptoms. With these symptoms, you have to consult with the specialist and go for routine investigations like urine test and ultrasonograph. That will give an idea about the disease, and that can be managed accordingly.
So as soon as he gets to know that there are the problems, he should directly go to the urologist or the surgeon.
Yeah, rather than.
Right. Thank you so much, sir, for being here. It was very nice talking to you.
Okay, thank you.